Welcome, everybody. It is great to be back on a Google Hangout. And today I have my friend, Eric Dinkens. Eric, say hello to everybody, please.
Hi.
So, Eric, you are in Colorado, Utah. You're somewhere out west, right?
I'm in Colorado. I'm in Castle Rock, Colorado, which is about 30 minutes south of the city of Denver. So
Now, I heard you guys got a little bit of a snowstorm recently. Yes, is that correct? Your first snow of the year?
very little. Oftentimes the weather gets amplified into what we get in the mountains is what we get in the Front Range area, and it's just not the same. So the mountains got their first snow. We have several ski resorts that are now open, but we didn't get much in the city.
Okay, very cool. Well, Eric, today we are here for a very important reason, which is to discuss the latest and most innovative advancements in functional rehab. And just to give the audience a little bit of background, I've been in practice now for 20 years, and I've seen lots and lots of rehab products out there. And several months back, my chief clinical officer, Dr. Barton Bishop, who's a doctorate of physical therapy and sports clinical specialist and all kinds of other alphabet soup after his name, he brought home this product and he said, take a look at this. And it was the motion guidance product. And I was just completely wowed. I was like, this is going to change the face of functional rehab. And I was so impressed with it. We got a kit right away. And really the rest is history. And we reached out to Eric and his partner, Tal. And we've decided, hey, this is something that we want to get out to the world because this is so important. This is going to help improve outcomes and help improve even the life of the provider who's going to actually use an innovative product, but also get amazing outcomes with this product. So, Eric, if you wouldn't mind, just give us a little background about yourself and also how you came to build this amazing product.
Sure, absolutely. Myself, I've been in practice for about 15 years, University of Colorado grad. And
Go Buffs.
my main background is sports medicine. I did about 5 years with the Stebbin Hawkins group and their orthopedists in their Denver clinic, and had a lot of exposure to sport and professional rehab there. And then I've been working in an outpatient clinic for the past 10 years after that, just seeing an eclectic mix. Along that way, I was a mentor for the University of St. Augustine post-doctorate residency program. That's where I met Tal. He actually did a residency with me. And while he was in my clinic and we were doing a lot of motion analysis type of things without all the bells and whistles, he had mentioned that, it would be nice if patients had more visual feedback for the actions that they were doing during their exercise to help some people get it. And that's kind of the genesis of where the motion guidance product came from, was out of necessity of not having things that we could use as resources in clinics to maximize the results that we wanted with our patients.
That's terrific. Can you describe to the audience a little bit about the product?
Absolutely. So it's a laser that is in a housing that provides a ball and socket mount that is very mobile yet very stable. So it allows us to be very versatile in where we can place the laser to get visual feedback, but also not to have to keep adjusting it on the patient. You can just spin the mount and point that where you need to point it. It's a series of straps and mounts that can pretty much go anywhere on the body, whether it's on the head, on the ankle, around the torso, to just about anywhere you need it.
And there's a target where the patient has to really pay attention to how they're performing a specific exercise so that the laser beam goes along a certain pathway and or maintains a certain position, correct?
Correct. We have a variety of things there. We have flags that you can either put on the floor or mount from a mirror or a window. We also have drop targets that are very, much more easily moved around on the floor. Those can also be hung on a wall, and that just gives the patient something to focus on, essentially, and also provides an assessment tool for a therapist or a chiropractor or an ATC to see more quickly what's going on instead of having to touch everything that we're doing or just use our eyes. It just gives us that immediate feedback on what motion or lack of motion is happening.
Yeah, it's great on so many levels. I love the assessment side. so many times in what we do, we're doing an assessment on a patient and then we provide a treatment and then we need to reassess and see how they're doing. Sometimes the patient might know that they've improved in that assessment, and other times they may not have. So for instance, if we're going in and doing an adjustment on a patient, we can palpate that patient's spine, do the manipulation, and then go back and repalpate the patient. I mean, they're like, oh yeah, I can move my neck now, but they don't really get the same assessment that we do. But with this particular product, they can actually see how they're performing assessment during the exercise and even reassessment. So it's giving them like immediate feedback on how they're performing and how they're doing in care.
Oh, absolutely. And that dynamic ability of this product just makes it so functional in so many different settings, whether it's a vestibular setting, an orthopedic setting, spine, extremities, youth, anything like that. It just allows them to see what's happening in real time versus putting in data information, having to go back and process that information and then link that to what they'd already done. You just get this information very quickly. It just compounds itself over time with what you were saying on, well, we get to assess it and then we get to treat it and then we get to reassess it, and then we have home versions where people can take that information that they've learned and keep doing exactly what we've done in clinic until we see them again.
That's fantastic. Yeah, I mean, I love the home unit. It's fantastic. It's a great way to keep patients engaged, and I'm curious. On your end, what have you heard back from your patients about the use of this product and how more compliant they are as it relates to their home exercise program?
Well, that could, of course, be a very biased answer. However, one thing is for sure is that that gap between the time that I see the person and give them a unit to when I see them back, 9 times out of 10, I can honestly say that we're doing advancement. So it's not, hey, go ahead and show me what you've been doing and I'll know if you've been doing it or not whether it was fun and sexy per se, but just I want to know that we aren't wasting time in between visits, so the next time you're in, the laser essentially held you accountable and made it fun for you to do things at home, and we can just move on from there because I can see that you're doing it the way that we practiced last time.
That's great, and the patient progresses faster, and it's better for them, it's better for you, it's better for the healthcare system at large. It's just a win all the way around. Some of the applications that I've thought about specifically in some of my work that we're doing in the community with concussion education is the assessment around concussion. What are your thoughts on that for both the concussion assessment side, but also the cervical vestibular rehab side?
Sure. First, I don't think we have enough directed research on the concussion side as far as how to do we really understand what we're doing there? And the reason I say that is because we have a concussion side and then we have a whiplash proprioceptive side, and those are going to overlap big time.
Absolutely.
So you can't treat one as a separate entity on each other. I believe USC is doing a lot of research on this down at their school. But you have joint position error with whiplash, and then you have the signs and symptoms that come along with concussion. And because they blend, a practitioner needs to know how to assess both and also treat both, of course. And so with the joint position error, especially with post-concussive and with whiplash patients, having them able to put a laser as a pretest on a target that's wrapped around the lasers on their head, have them do motions, have them do those with eyes closed, maybe change their body position, and then have them see if they still line up. The research is already there, done with a different population, but we should be doing that with the concussion population as well. If we can somehow integrate that into the future of creating baseline testing, especially for our athletes or some of our workman's compensation patients, having them do this beforehand, we can tell who's within a standard deviation norm and who's outside of that and who needs to be rehabbed. So as an objective tool, we're really excited for the future to be able to start doing that.
Yeah, it sounds like a tremendous opportunity. So for the providers out there that are saying, hey, I've got to have this in my practice, and by the way, providers, docs out there, you need to have this in your practice. What is the implementation like? How does it get integrated into your rehab-based, functionally based practices?
So I'm not sure I exactly understand that question, but just where you can get the device, is that what you're talking about?
Well, I'm talking about, most practices have a way of treating their patients. And so how would a doctor now take this tool and begin to integrate it into their assessment and or rehab side?
So that's going to be very easy because it all depends on, let's see here. Did I lose you there?
Nope, we're still here.
Okay. Sorry. Very easily integratable because it's just a simple concept. So whenever you need to see somebody move, or whenever you need to see something not move and be stationary, being able to put that wherever you need to is going to give you that immediate feedback. So it's going to blend seamlessly with what you do, whether you consider yourself to be a very manual practitioner, whether you consider yourself to be very exercise-based, I'm big on home program. However you tend to run your clinic, this is going to implement seamlessly and provide an avenue, a resource for them also for home.
That's terrific. Where are some of the resources available, or what shows, what conferences are you going to be at where the doctors can see this product?
Sure. So coming up in actually next week it is, we're going to be at the private practice section of the APTA in Orlando, Florida. After that, we're going to be at the sports section physical therapy conference in Las Vegas. So if anybody wants to come to Vegas, there's your reason and your excuse for a few extra days. And then after that, we have combined sections meeting in Anaheim, California, and then we're going to be at the Parker convention coming up in 2016.
That is fantastic. I'll be seeing you there, and we got to get a lot of people over to the booth. And actually, every time this product gets out in a booth, doctors just flock to see it because it's so cool, it's so different and unique and so impactful. If they want to get the product now, where can they find this? Where can they find the availability, how to purchase it, all that good stuff?
Sure. So we have a couple avenues. The easiest one for everybody right now is to go on to motionguidance.com. It's going to pop up our website. You'll have access to our the product information, how to purchase it, the different products that we offer, not only the motion guidance kit, but also some contact pads and some downloadable things that you can use in clinic and things like that, as well as a blog area for more information about how we're integrating this with more science that's already out there, as well as hopefully future research studies. That's
fantastic. That's great. Awesome. Well, for our viewers, anything else, any final thoughts that you'd like to share with us today, Eric?
Yeah, probably just one, technology, whether we like it or not, is already finding its way into our clinics, whether it's a very high-tech thing or a low-tech thing. People are already bringing in their cell phones, their iPads. They're using different apps to gain information. So the technology aspect is already there, and your patients are already grasping onto that because now it's necessity for societal norms. This is going to blend with that very easily. They're going to understand it. They get it very quickly, and it just makes everybody's life easier in clinic.
That's great. Well, I got to tell you, I thank you so much for you and Tal creating this fantastic product, helping our patients get better faster, improving outcomes, saving the healthcare system money, and just creating wins all the way around for providers and especially for the patients that we serve. So thank you, sir. I appreciate your time today. I appreciate the phenomenal product that you guys have built. And for those of you out there watching this, check out motionguidance.com. It's a great site. They've got great products, and they are great people. Eric and Tal are great folks. So Eric, great to see you. I will see you in January at Parker. Thanks so much for spending time with me today.
Appreciate it, Jay. Take care.
Talk to you soon.